Hi, Katie.
Hi, Natalie.
Hi, Tim.
How are you?
Good. Thanks for joining us. All right, let's get started. Welcome everyone who has joined our Healthcare FinTech webinar series. I'm Natalie Moore with Salucro, and in today's webinar, we're going to discuss how marketing and revenue cycle teams can work together to improve the patient payment financial experience. We have two incredible thought leaders who will be presenting today. The first presenter joining us is Tim Donovan. He's the Chief Marketing Officer with Care Credit, and Katie Nelson, the Vice President of Customer Operations here at Salucro. We'll be asking a few survey questions along the way. Look for those questions on the top right-hand side of your screen. And at the end of the webinar, we'll be providing you with our patient payment technology report, as well as a few other takeaways that are going to help you create your marketing plan. You can access those resources at any time using the Handouts tab. And lastly, if you have any questions, please use the live chat feature, and we'll answer as many of your questions at the end during our Q&A session. So all right, let's get started. I'll hand this over to Tim for a quick introduction.
Thanks, Natalie. So first, a little bit about Care Credit. Care Credit has been in business for over 30 years, and we are the leading health and wellness personal care credit card that helps patients and clients get the financial help they want and need without delaying appointments or treatment. It's a little over 12 million cardholders with acceptance at about 240,000 plus locations across a variety of healthcare specialties in pharmacy and veterinary locations. And we extend over about $40 billion in available credit for people to use the card for care again and again. So now have Katie tell a little bit about Salucro.
Hello, a little bit about Salucro. We are a healthcare technology company exclusively focusing on improving the patient payment and billing experiences for healthcare providers and their patient base. We provide enhanced workflows, integrations with providers' leading EHR systems, along with being very focused on providing retail-like payment experiences to the healthcare community by incorporating advanced payment types such as Care Credit, PayPal, and Venmo to create a payment experience that is seamless as possible for providers and patients. All right, Tim, want to kick it off?
Sure. So we're really talking about the opportunity for providers to have conversations with their patients about costs available to them, the payment options, and different ways they can finance the care they want. And it's important to have this conversation at the beginning stages of the journey, throughout the journey, really every stage of the journey, to make sure that as things change, as different treatments are pursued, that the patient and the provider have the conversation about the types of care and the cost of that care, and that they're prepared for every step of the way. And really, the point of this whole focus is to look at the different stages of that journey and where you can have an opportunity to talk to your patients. And we have some different tools, techniques available that we're going to share with you. Katie?
All right. Well, we tend to think first and foremost about patient quality of care when we evaluate a healthcare organization. But the truth is, the financial journey can have just as much of an impact on the overall satisfaction of a patient. Today, more than ever, patients are shopping to determine which healthcare provider is accessible, convenient, and cost-effective. Healthcare organizations need to develop strategies to provide patient financial engagement efforts through the billing and payment process. The rise in healthcare consumerism means patients are expecting the same frictionless experience they receive in other verticals, such as retail and financial services. Providers who are not prioritizing the financial aspect in the overall patient journey are putting themselves in a position to increase patient turnover and jeopardize brand loyalty. According to the Salucro Payment Technology Report, 50% of individuals surveyed said that positive patient experience did not follow through to the billing and payment process. And 42% of individuals stated that a confusing or incorrect bill could prevent them from returning to a medical provider. That is a huge area for opportunity. A quality patient experience should start with a welcoming and easy to navigate digital front door and follow through to the billing and settlement process. And the way to get there is to create a cross-departmental collaboration to help improve revenue cycle metrics as well as patient satisfaction from start to finish.
Talk about the different techniques that you can use to spark engagement throughout the patient financial journey. We're going to talk about 5 different areas. The first is managing your online reputation. People looking more and more at the ratings and reviews for different providers. What can you do to address that opportunity? Second, how are you looking at the ability of your patients to navigate your online payment portal and the online payment experience? Is it easy to use? Is it simple to understand, and all of that? Third, if you think about how more and more people are looking at the optimal retail experience, healthcare is getting there too. Can you offer a retail-like payment experience that's as simple as one click away? Looking at the communication plan, are you using all the channels available to you? Is your website up to date? Are you using text messaging, emails? Are you using social media? How are you making sure that your patients understand what to expect when they come into your practice, what to expect when they get care, and then also what do they expect when they get the final bill? And I think importantly, to underscore all of this, is making sure that your team is on message and they understand what they're supposed to say, how they're supposed to say it, and everyone's on the same page. So I think we're going to take a quick journey here to see that first step is, how do you rate? How do you look at ways to manage your online reputation? You see here, more and more people are looking online for information, whether it's where to get care, the cost of care, the type of care, and also how to pay for it. 70% of patients say that a positive online review is critical when selecting a healthcare provider. So how do you make sure that you're doing all the things you need to do to protect that and to make sure you're addressing it in a timely manner? Okay, Katie?
Well, we can't just focus on the positive reviews. We also need to review the negative reviews as well. Negative reviews online from a patient is an opportunity to improve patient experience. Although no one likes to be the subject of negative reviews, these findings should reassure you that a single negative comment, particularly if it's an outlier among favorable comments, is not going to keep patients from selecting that provider. The real opportunity is to focus on any emerging patterns from negative comments and to target those areas for improvement. Of all the trends in healthcare marketing, the most powerful focuses on the patient experience. To get started, work with your marketing teams to create a marketing standard operating procedure, which outlines the expectations for delivering a positive patient experience. Within the procedure, include approved messaging for handling all online review responses. It is important to always address the reviewer, say thank you, and if there are issues, take them offline. Set a timeline, respond promptly. The online world operates 24/7, and as healthcare consumerism rises, patients expect a quick response. So make a goal that all reviews are responded within 24 to 48 hours. And last but not least, collaborate with the revenue cycle teams on patterns and themes. Work together on resolving issues and improving the overall patient experience journey, which will drive those positive reviews. Now that the patient has seen your reviews online, your online bill pay needs to be patient-friendly and offer a digital payment experience similar to other online retailers. Healthcare providers can learn from brands in other fields that are already using data-driven marketing to create a better experience. As an example, Amazon makes it easy for customers to purchase additional items with the use of the one-click buy button. At Salucro, we are working with providers, understanding even the smallest changes can lead to a big difference in patient revenue. As an example, the location of the payment button, the text itself, pay now or view my bill, will produce better results. Conducting this analysis will identify which changes have the greatest impact on patient behaviors. Another consideration is the average time to make a payment. Again, healthcare consumerism is only rising, and patients have high expectations for the type of user experience organizations provide. Having a design-driven payment process can both safeguard its patient's user experience and accelerate patient payments. Patients' willingness to pay increases based on their experience. If the payment process is not easy and user-friendly, patients will move on. High quality care will remain the most important focus for healthcare organizations, but 65% of patients responded that accessible locations and digital experiences similar to online retailers would deepen their loyalty to specific providers. So it is really important to take a look at your payment experience and compare it to other industries. So some of the key questions to ask yourself when you're evaluating your online payment portal. Where are your patients viewing their statements? Does it take only 3 clicks to view? When a patient logs in, is it easy to find their balance or perhaps a child or companion balance? Is there support functionality like phone support or email support? Or what about that live chat that provides that 24/7 on-demand access? All these factors are important to the overall patient experience journey. Healthcare providers can add significant operating margin and reduce receivables by making the payment process easier and more patient-friendly. Making it easier for patients to make a payment, especially with today's need for digital tools offering retail-like payment options, have never been more in demand. In fact, 65% of patients want a digital retail-like payment experience while also experiencing a positive financial experience and having healthcare financing options. With higher deductibles and out-of-pocket expenses, patients are taking a larger percentage of healthcare payments. Providers need to model their payment strategies around the patient and enhance their patient's financial experience.
That when you think about the retail-like payment experience, people want options. They want to know what's available. They want you to meet them where they are. And it's no surprise that this is true with the healthcare journey and the medical experience. People want to know what kinds of options are available to them when they're receiving a medical bill. 35% said that. And if you think about millennials, these are folks who maybe are not as high consumers of healthcare, or they're just getting into some really significant medical expenses. They want to know what information on payment plans are available when they're receiving a medical bill, because they're used to getting that information in other places where they shop or where they buy other services. And if you think about in the backdrop of the pandemic, having a greater understanding of the financing options available to them and the payment tools and plans available to them, this is increasingly important. In some research that we did with our own cardholders, we found that 79% of them said they really consider care credit important in their current circumstances. And this could be because they have interrupted income, interrupted employment, and things that maybe have caused their cash flow to be somewhat unsteady. So having a tool available for them to pay is critical. The good news is that a lot of these people, 90% of them said that they expect to use a card like care credit as much or more than usual in the next 6 months. So there's pent-up demand for when things start to return a little bit more to normal and more elective care procedures and other care is available. They want to get out there and they want to get the care they want or need for themselves and their family.
We talked about what patients are looking for, but I'm curious what healthcare providers are offering today. So let's take a live poll. On the right-hand side, you will be able to submit your responses. What modern payment technologies are providers currently offering to patients? Do patients have the ability to set up payment plans, have that quick support access, or save card information to make it easier for their next payment? Family bill information together, retail-like payment options, just like your retail payment experience, or perhaps accepted payment history and receipts. While the group is completing the poll, let's discuss the results from the Salucro technology report. 44% of individuals surveyed expect payment plans, and 38% are looking for that retail-like payment option, such as Care Credit, PayPal, and Venmo, while 30% want that quick, instant access. Depending on patients' financial situations, healthcare providers that offer options with flexible payment plans And with that instant access to multiple payment options will ultimately drive the financial experience, which increases the overall patient satisfaction.
Like the rubber meets the road when people get their bill and they get their final statement. And they don't necessarily like to have a big surprise when they get that final bill. 91% of consumers said that they were surprised by a medical bill. And I think many of you, if not all of you, have experienced this at some point in your lives. You like to know what to anticipate, and you like to know what you can do to prepare for that. And it's increasingly important because as more and more consumers are shouldering the burden of cost and shouldering the burden of the cost of out-of-pocket expense, they want to know, what are their providers doing to prepare them for that? What kind of information do they have available? 65% of them said that they would consider switching providers after receiving an unexpectedly high bill. So the cost is real and the impact is real. People want to know what they're getting into, and they want to have the conversation up front. And more importantly, it's not just the provider, it's also the office staff, making sure that they're equipped to tell the story and they're equipped to make sure that people understand that healthcare and patient financing is available. And again, 56% of patients said they would consider switching if the office staff couldn't tell them the cost of the visit or the procedure. So it's really important that we start to bring the conversations around cost and care to the forefront and at all stages during the patient journey. Now, this is especially true when we look at the final billing statement. So I'm going to have Katie give you some tips on what to look at there.
Absolutely. Thanks, Tim. Yeah, patient statements are a major touch point that bridges a patient visit with their financial experience. No matter how much providers work to deliver quality care for their patients, our research shows that poor billing experience can undermine even patients' most positive clinical interaction. So creating the perfect mix of easy to read with the right information is crucial. When we are implementing statements at Salucro, we include 4 important components. Starting off with brand and balance, making sure it is front and center. We list the multiple ways to pay so patients can take advantage of all options available to them. Then highlight self-service options to make payments such as mobile, IVR, and online. And lastly, we include those QR codes so patients can use their smartphone technology. Billing is one of the most consistent touch points providers have with their patients. It's imperative to ensure communications between both parties is tailored to how patients want to receive communications for upcoming bills and payment reminders. So a question for the group. How do you think patients prefer to be notified by providers of their upcoming bills and payment reminders? Again, on the right-hand side, you'll be able to see the poll. Do you think patients want to receive a paper statement, or perhaps a text message, or maybe a phone call reminding them to make a payment, or maybe an email? As the group wraps up the poll, let's discuss the Salucro Technology Report. We found that 39% of patients prefer communication channels like email and text message notifications. Patients certainly want that quick, instant notification. Part of the experience is being able to avoid the hassle of junk mail, paper checks, and placing things in the mail. Giving patients the ability to access their statement via email or pay online or by text is the ideal payment experience.
It's really important to understand what the patient journey involves and how there are different stressors at every stage of the patient journey. And whether it's for follow-up care, unplanned care, or even routine care, there are certain points along that journey that are important for patients and providers to have a conversation about what to expect. If you see on the left-hand side of the page, the stress levels are most acute at the beginning and the end of the journey, when they're trying to figure out what kind of care is needed, and then certainly at the end when the invoice is needed. This is where there's probably the fewest, most unknown answers to the questions they have. What kind of care are they supposed to get? What kind of cost is going to be involved? Is insurance going to cover it? And so on and so forth. And the more they get to the actual care appointment itself, the stress levels go down because they have a better understanding of what to expect and what to anticipate. The same should hold true for the payment experience and the overall cost. The more informed people can be, and the more you can try to manage expectations around the cost of that care, the more we can start to reduce what might already be a stressful experience. So it's important that at every stage of the patient journey, there's a financial conversation, if and as appropriate, to have between the patient and the provider. So now that we have outlined the different patient journey, let's walk through a couple of examples on how marketing can help guide the patients through these different stages of the experience. So Katie, go off here. Okay.
All right. So an example of how to use a positive review. Ask a patient to write a testimonial. It can include an image or just text, but that is a great endorsement you can use on your company website or on your social media channels. Ensure that future patients have the most convenient access to all information they seek by including comments, both positive and negative, and also include those ratings of current patients. Paying attention to the volume and quality of your reviews online is extremely important. Build a great website that fits your brand. Make sure you are using your website to highlight all your payment and financing options available. A beautifully branded website is a fantastic way to let patients know what you are offering. A great way to display the payment options and to show how easy it is to make payment ensures a great user experience. So when we think about the check-in, we need to remember the first and last moments of a patient interaction are what patients are likely to hold in memory as a permanent snapshot that encompasses their entire visit. Work with all patient-facing teams on patient experience communication strategy. Provide scripting to keep your team on message, and it also creates a consistent welcoming during check-in touch point. Informed employees are your best brand ambassadors and can help boost your patient satisfaction. Make sure your team is well informed about all your payment functionality and financing available, and how to navigate a patient through your online portal. Flyers and printed materials like patient information brochures are great to keep in the office for the team to reference, and patients can use it as a takeaway. You can showcase payment options, payment plans, or any other message that is important to your practice. And always include those QR codes for a quick paperless option. On the right side, you can see an example we made for one of our clients who was introducing all the new payment options that can be paid through the IVR, text, and online. The flyer educated patients of all the new payment options and ultimately drove the overall adoption rate. Now, throughout the checkout process, it's important to remember that the checkout process is a revenue protection and patient retention touch point. It is important your team works with patients on how to best communicate with them based on their expressed preferences. Collect email addresses, mobile phone numbers, and work with your patients on how to best communicate payment reminders and payment options. Highlight the convenient contactless payment options such as e-statements and text-to-pay notifications. By offering patients their choice of communication methods, a healthcare organization can improve patients' overall experience and satisfaction, which increases engagement and results in higher payment rates.
Obviously, bringing this all together is making sure that you are keeping the team on message and making sure they understand their responsibility in this process. Make sure that you're using all the communications channels you can with your team to make sure they understand what's happening. Look at your emails, look at your company newsletters, look at all the different ways you can communicate with them so that they have a clear understanding of what they need to know and what kind of conversations they need to have and the tools and training available to them. And then obviously when you're looking at how you're communicating, what are you doing to make sure that you're staying on brand, on message, and that you have the right communication tools available to you? Do you have a style guide in place to make sure that everything looks as it's supposed to and that everything goes out as consistently as possible? And of course, lastly, it's important to have people who are championing this cause. You need to have team leaders, both from the marketing side as well as the revenue cycle management team, to look at what's working and what's not. Where can you find ways to improve the communication? Where can you find ways to improve the tools you might be using? But make sure your message is consistent throughout the entire revenue cycle process. And all of these things are important to bring together and look at all the things we talked about a little bit further to make sure that your front line is equipped to take care of all the things that we've mentioned. So I think in summary, there's a lot of great things we talked about today. 5 different ways that you can look to improve the overall conversations with your patients and improve that patient financial journey. Look at ways you can manage your online reputation. Are you looking at the ratings and reviews that are out there about you and your practice and the providers in your office? Are you addressing those questions? Are you addressing the criticism, both the negative and the positive, making sure that you're handling them in a timely manner? Because all those things matter, and people are looking for that as they're looking online for information about care. Look at the ways you are paying your bills online. Is it intuitive? Are the buttons in the right place? Is it as simple and easy to use as, say, an Amazon one-click experience? Do people know how, when, and where they're going to pay? And the quicker they do, the quicker that you get paid. Is it as simple and seamless and easy and convenient as a retail-like payment experience? I mentioned Amazon. Are there others like there that you've experienced on your own, where you thought this is incredibly easy and intuitive and I didn't have to really work that hard? Think about that same experience you want to create for your patients. Is there a clear plan in place to make sure that patients, you have an understanding of the preferences they have for how they want to receive information from you? Are you using that on an ongoing basis? Are you using all the channels available to you, like your website, your emails, your mailings, your social media, all the things you can do to give access to information and make sure that people understand what they're getting into and what to expect at any point during the patient journey. And then, of course, keeping your team on message, making sure that they are equipped with all the information to make sure they're employing the tools and techniques that we've talked about, and that they know the right way to speak about that. They're making sure they use the correct information, the guidelines, and all the terminology is consistent across the board, so you're all on the same page to do the right thing. So with that, I think that's it for the presentation. We are going to open it up for some Q&A.
Let's go to this question here. This one is for Tim. Great question from one of our viewers. I understand how important technology is right now, and patients seem to want it, but I worry about going too far. There are already so many barriers to give our patients personal time and attention. How do we keep technology from getting even more in the way?
That's a good question. I mean, many of us are depending on technology for so much today in so many aspects of our lives, more so than ever before, and sometimes not even by choice. I think what's crucial is really being thoughtful about which technology we use and how and why we use it. Thinking about technology can actually enable or enhance a patient and provider relationship. Like when you have the ability to have an empathetic, engaging conversation during a video consultation, or when patients can get answers through a quick chat or a text. That's really important that technology is there to help them. Cost and payment options don't have to be cold transactions either. They can be presented in the form of wanting to inform and empower patients, helping them understand how they're going to manage the cost of care in a way that works for them. I think in this case, technology is just a tool. What you do with it and how often in the ways you use it is really what matters most in enhancing the provider and the patient relationship.
Thanks. Good answer. Let's see, another question. This one, again, is for Tim. You mentioned that many patients want to know more about payment plans, and the pandemic has probably driven that up. Our challenge is staff. Some of our staff members just aren't comfortable talking about the financial side of things and don't think it should be their job. What do you recommend?
So this is a common challenge. So whoever asked the question, you're not alone. Even when circumstances are really great, most of us don't like to talk about money, and certainly you don't want to talk about money and healthcare. It's awkward. Even so, it's important, especially when cost can be a challenge and budgeting may be difficult. Patients want and need to know what their obligations might be, and your business needs the price and the payments to be handled well and consistently. It may help to keep reinforcing with your team, but these conversations may be uncomfortable at first, but having them helps the patients. And the more you do it, the easier it gets. We recommend having some basic training and ongoing support so the staff can practice, build on their comfort levels, share their tips and experiences, and be able to field the kind of questions that they're getting.
All right, here's one for Katie. Which has more of an impact on my NPS score? Good reviews or bad reviews?
We all know a better patient experience can improve your NPS score, but patients are quicker to write a negative review. That is why it's so important to set up a process to address the negative reviews quickly, giving you the opportunity to turn that review around and create a brand advocate out of a negative experience. Both types of reviews can be responded to in helpful ways to help your practice. Bottom line, happy patients make for a positive review and can help promote that net promoter score.
Makes sense. Thanks, Katie. Let's do one more question for Tim. I think we have time for one more. Here we go. I get that the whole journey is important, but assuming we're starting from square one, are there points that are more important or most vital? If we need to pick somewhere to start, where should we start?
There really isn't a bad place to start. Anything you can do to improve the patient financial experience is a step in the right direction. I think there are two ways to think about where to start. First is, where do you think the biggest need might be? For example, our research found out that patients experience the most stress early and late in their journey when they find out the care is needed and they schedule an appointment. And then, of course, when they receive an invoice at the end of the process. If you can use technology to help with scheduling or payments, anything to do to provide reassurance or information and options related to the cost, any part of this journey, it will help them a lot. I think the other angle is looking at your team and looking at your infrastructure. Is your website and your billing system, are they limited in terms of what you have there? But maybe you have an outstanding staff that's really great with the patients. In those cases, maybe you focus on sharing the cost of the information during the appointment, or using like the low-tech solution like a text so that people can quickly and easily chat with patients and easily make that connection. So there's a variety of ways that you can do it, and there is no bad place to start. But certainly the beginning and the end are the areas we've found that are most important.
Great. Let's do one more since we're here. I've got another good one for you, Katie. What do you think is more important, in-person patient experience or the digital presence?
Quality in-person care is absolutely the most important. However, in our current climate, the digital presence is a must-have. Interactions are now contactless, and your digital experiences have to be able to meet your patients wherever they are. By reflecting the same quality and service throughout the patient journey leading up to and post-visit will validate the quality of care you offer in person and will add tremendous ease of use to your patients, creating a seamless experience.
All right, well, that is really all the time we have left. So we got a few more questions coming in. We'll make sure to get back to you each individually with those questions that we weren't able to answer today. But just want to say thank you for joining us all today. We hope you enjoyed our webinar, and special thanks to Tim and Katie for leading us through.
Thanks for having me.
Oh yeah, thanks guys. We'll be sending a follow-up email with all of the materials if you didn't download them today. But thanks, Tim. Thanks, Katie.
Thank you, Natalie.
Cool. Thanks.
See you later, Tim.
Bye.
Bye. Have a great week.
You too.